Hi everyone, my name is Megan Jones and I'm a current LPN to BSN student at Indiana State University, and today I have video number 5 in a short series of health education videos. Our topic today is going to be bystander CPR, focusing on hands-only and AED use. So before we get started with everything today, I'd like you to take a brief moment and pause this video and take a pretest that I've made for you. You can go ahead and find the link in the comments section of the video. So before we get started, I want to go over some learning objectives, the things I really want you to take away from today's video. I'd like you to be able to define cardiac arrest, explain what it means to perform hands-only CPR, identify the percentage of cardiac arrests that occur outside of the hospital setting, describe what an AED is, identify the age at which you can start learning how to give CPR, and explain the benefits of performing CPR. So our population at risk, the people we really want to make sure can see this video and learn from it, they're going to be children and adults ages 9 years of age and older. And the reason we pick that age is because according to the American Heart Association, age 9 is an age where they can start learning how to do CPR. All right, everyone. So before we really dive into the hands-on CPR aspect of this presentation, I do want to take a minute just to go over cardiac arrest, since that's a primary reason why you have to do CPR in the first place. So a cardiac arrest is basically the cessation or the ceasing of the heart to function, and that usually occurs very suddenly, and oftentimes it's fatal. In the United States alone, each year more than 350,000 people will suffer from a cardiac arrest. 75 to 80% of these arrests will actually occur in the home, so it's happening to people you know, people you care about. And 46% of those who suffer a cardiac arrest in public will actually receive help from a bystander before medical personnel arrive. So the goal is to increase that number. And nearly 90% of cardiac arrests that occur outside of the hospital setting will result in death. So what is CPR? CPR stands for cardiopulmonary resuscitation, and CPR is the application of performing chest compressions to someone who suffered from a cardiac arrest in an effort to keep the blood flowing to the vital organs, and it can be performed with hands only, like we're going to discuss here, or it could be alterations of chest compressions and rescue breathing. So hands-only CPR is so important because if a cardiac arrest occurs, your chances of survival after receiving immediate CPR can double and even triple. CPR makes it possible for your vital organs to still receive blood flow and to function. And hands-only CPR can decrease your risk of brain and other permanent and serious injuries. A cardiac arrest victim's chance of survival decreases 10% for every minute that CPR is not performed. So if you're someone who does not work in the healthcare field or you've never been in a hospital setting, the concept of performing CPR can not only be very intimidating, but it can cause you to have some anxiety, it can make you feel scared, and that's okay. But just remember there are some ways for you to tremendously increase someone's odds for survival if they go into a cardiac arrest. One of those ways is a two-step process called hands-only CPR. There's no mouth-to-mouth involved, just strictly using your hands. So the first thing you're going to want to do is you're going to call 911, and then you're going to begin your chest compressions. You want to push hard and fast in the center of the chest, and I know it feels like you could break a rib, and you might, but that's okay because a broken rib is much better than the alternative, which could be death. And you want to aim for 100 to 120 compressions per minute. And to help keep your rate going steady and strong, you can use familiar songs to sing along to in your head, such as Stayin' Alive by the Bee Gees, Walk the Line by Johnny Cash, and Crazy in Love by Beyonce. So another way to help out with CPR is to use an automated external defibrillator known as an AED, and you've probably seen them around in the grocery store, maybe your place of employment, and they're a device that can help reestablish your heart's rhythm and make it more normal. And they'll analyze your heart's rhythm or lack thereof, They'll assess if you need an electrical shock, and then they'll give that shock if it's needed. Now, a study that was performed by Johns Hopkins University found that when cardiac arrest was witnessed by a bystander and they used an AED, 66.5% of them survived in comparison to a 43% survival rate of cardiac arrest patients who did not receive a shock until a medical crew arrived. So using an AED by a bystander can more than double your survival rate. Now, for those of you who aren't certified in CPR, I definitely recommend taking a CPR class because it can definitely come in useful to anyone at any time. You never know when you might need it. There's a variety of classroom settings available to you for your learning needs, and that's going to include online options, and they allow you the convenience of learning in your own home on your own time frame. But the only thing with that is there's no in-person instruction, so you may not be able to be certified depending upon different regulations from your state, your job, or whoever. There's also in-person classes, and this option is great for those of you who are hands-on learners, that you like having an instructor ready available to answer your questions for you. You can become very knowledgeable about CPR and using the AED in the classroom setting. You can be in a group setting, or you can be oriented on a one-on-one basis, and that instruction will give you a CPR certification. The other one would be a blended option where you might do most of your learning online and then do the certification process in person, so you get a little bit of each with that. So what can you do to help in the event that an emergency type of situation occurs where CPR might be needed? Well, the first thing you want to do is assess the scene around you. You want to ensure the safety of not only the person who has a potential cardiac arrest, but you want to ensure your safety as well too, because you don't want two people to need help. And then you're going to tap the victim's shoulder and ask them, "Are you okay?" And then to assess their airway and open it up a little bit, you want to tilt their head back by lifting the chin. If you know that they're not breathing, you're going to call 911 immediately. And if someone else is available, send them for an AED, and you're going to begin CPR. You want to emphasize those high quality chest compressions, and you're only going to be doing the hands-on CPR, so remember you want to do 100 to 120 compressions per minute. Sing those songs that we talked about earlier to help you get through that. So if an AED does become available to you, you want to make sure you connect it to the person. Place the pads in the appropriate locations. Most AEDs have a little picture guide that shows you where to place the pads. Make sure you follow the prompts that the AED says. And when it asks you to stop compressions and clear the area, make sure you do that. That way it can provide the needed shock. Now, if there's no AED available, or you're the only person on the scene for this cardiac arrest victim, keep doing that hands-only CPR. Just keep doing those compressions. I know you might get tired, but power through it. Make sure you're getting that 2-inch depth if you can, and trying to do 100 to 120 compressions per minute. And you'll just do that until help arrives. So I know we talked earlier about finding a CPR or AED training program. So I have that link here available to you. It helps you find a local place for you to take those classes. There's also another resource, hands-only CPR resources, and it's going to give you resources on social media. It's going to give you some music resources for some of those songs that might be more familiar to you. There's also an implementing an AED program. It just goes into more detail about an AED, what it is, and how to use it. So those are some good resources to check out if you have a chance. And this page is just my reference page. I just want to thank you guys for taking the time to watch this video, and I'd like you to take the test that you took at the beginning of this presentation again, just to see how you do in comparison. Thanks again.